And now our next speaker, Tulika Narayan, will speak about a continuing role for biofortification to address micronutrient deficiency.
Morning, everybody. And keeping up with Anthony's theme, I'll talk a little bit about the tool that we use to actually answer this question. Is there a role for biofortification to address micronutrient interventions? And in fact, as a matter of fact, what is the role for any micronutrient intervention to address this issue? And in presenting this, I recognize my co-authors, Lauren Olshow, Ben Johns, and Abby Conrad, who are also with APT Associates. So starting out, our task was to really figure out what's the most ideal intervention for addressing micronutrient deficiency now and then looking ahead. And it's really important to map those out. So there are two broad categories. There's the food-based intervention, which includes biofortification, which is breeding of crops with micronutrient-rich traits. And then there are these host of interventions that improve the quality of diet. So these are all the food-based interventions. And then on the right side is the public health interventions. There are supplementation, micronutrient powders, and fortification that sort of straddles across the two because you're fortifying foods that you typically consume. And generally these are on the right side are recommended more for moderate to high micronutrient deficiencies. So with that framing in mind, we conducted a pretty intense literature review to document evidence around efficacy of these interventions, their reach, and their cost effectiveness, and synthesize that to sort of summarize what our findings were, that supplementation, fortification have established evidence of efficacy for addressing vitamin A and iron deficiencies. And by the way, we looked at vitamin A, iron, and zinc only. And they have significant reach. They've been rolled out quite a bit. And cost-effectiveness studies have been done and sort of established. While the information is emerging for biofortification, efficacy has been very well established by a series of wonderful papers done. And one interesting thing about reach with biofortification is that the whole idea was that you would biofortify the seed with nutrient-rich components, and farmers would grow it and they would consume it because that's what they typically do. And your advantage is to reach those populations that are not having access to fortification. However, getting the seed to the farmers is not as easy. It's sort of extension 101, getting the farmers to adopt the seed. So that was one piece that we sort of saw in the reach piece. Although for biofortification, although for supplementation and fortification, also there needs to be a lot of political will to continue those programs which affects their sustainability. And of course, one important thing is that efficacy is established, or there is emerging evidence of efficacy established for zinc and not so for the others. So, synthesizing that roughly as we were looking into this, we recognize that supplementation is a need that you must have in parallel because that's the only intervention to really address high micronutrient deficiency and to address mortality. So we sort of set that aside in looking at how to come up with a recommendation. And fortification is cost effective, but only to populations that are consuming fortified products, branded products. While biofortification's advantage comes where fortifications it cannot reach and where people are consuming their own products. However, the importance of interventions that address better quality of diets is something that you have to do in the long run because that is the most sustainable and the natural place you want to be. So keeping all this in mind, obviously, one of the key tasks we did was to review the various models that are there to make that recommendation. And there's been a vast amount of literature and modeling that has been done around it. So there's one simple tool called the Fortification Assessment Coverage Tool that sort of looks at who's consuming fortifiable products, are they branded, are they fortified or not, and determining the coverage gap that exists and what populations fortification can reach. And then there is a biofortification prioritization index developed by Harvard Plus, which looks at micronutrient deficiency and consumption of these biofortifiable crops. And neither of them sort of really considers each other. However, Harvest Plus has done a portfolio analysis that does do it side by side, but it's a prospective analysis and has these assumptions around adoption, which again we found was the most critical sort of step in getting the seeds to the farmers. So the models are very sensitive to those assumptions. Similarly, there's Minimax and Optima nutrition modeling also, which does put these things together and side by side, but rests on certain assumptions to make prospective assessments. So what we instead did was to just modify fact, which is really based on what's happening now in a snapshot, which seemed like a more transparent, sort of clear way of sort of getting a sense of what the potential might be. And very importantly, also looks at the consumption of micronutrient-rich products. So I'll talk a little bit more about that. So essentially, what we see it is like it sort of probably brings the nutrition ag teams together to sort out the ideal implementation. So it does involve a pretty strong qualitative piece. You sort of need to go in and figure out what your seed systems are like. Are they strong enough to sort of allocate the seeds? What's the role of private sector? How are these fortified products being produced? Are they centralized or not? Because that'll determine the cost effectiveness. What is the plan for the government to have fortification programs? Because if they're going to have a fortification program, then you need to consider that for biofortification. And then, of course, then we go back to data to do the analysis. And I'll talk a little bit more about that in the context of an example because it becomes clearer that way. So let's go to Eastern Uttar Pradesh, pretty close to my hometown. This slide sort of summarizes the qualitative component of our work. You go into the field, you talk to the government, the key experts. There's a lot of folks working in fortification, biofortification, and get a sense of what the lay of the land is in terms of fortification efforts that are going on, whether they're voluntary or mandatory, and what are the different products that are actually in the market that are actually fortified. And so we sort of brought all those pieces together, and there's a bunch of fortification going on, notably voluntary though, mandatory only in PDS. And I'll come back to that point more towards the end of why that's super important to understand whether it's voluntary or mandatory. So you get a sense of what the biofortifiable crops are. It takes a long while to develop them. So in terms of looking ahead, you want to see what's already been developed. And then very importantly, understanding what their dietary diversity is, what are they generally consuming. So with that sort of in hand, then the idea of the tool is to try and leverage the data that already exists. We had good data from a survey that was done by Ipsos, funded by Gates Foundation. And we're looking at all the different elements. Here down below, we sort of bundled together all the micronutrient-rich foods, and you can sort of see already where red is basically no consumption, there's a giant gap for iron and zinc-rich foods. And that's basically animal protein, and there could be economic reasons to not access it. And on the other hand, the vitamin A-rich food, actually there's a lot of households reporting their consumption. And therein sort of lies the potential for interventions that can improve the quality of diets. We don't know what the quantum is, but at least the potential does exist. And looking at the fortifiable ones, if you really look at, let's see if I can get this to work. So black and the grays are the places where households are reporting consuming branded products. Whether they're fortified or not was not available in the information, but the fact that they're consuming branded means mandatory regulations could go pretty far. However, in India, most of it is pretty voluntary right now. And then as you can see in rice and wheat, there's a whole bunch of green. Now green is access to local products, which means they're not really buying it from the market, but where that is not an advantage for fortification is the advantage for biofortification. So if you look at all the biofortifiable crops, the dotted areas are where biofortified crops could have a role to play. Now let's flip this a little bit and look by micronutrients. So this is what we did. Essentially, if you look at this graphic around iron, vitamin A, and zinc, if you focus on the red, that's the set of households that do not consume products that are branded, which means their reach for fortified products is really low. They are also not reporting consuming micronutrient-rich products either. And so if you look across the spectrum and you had limited resources and you're trying to determine where should I focus my energies on or my resources on, it's pretty clear that zinc is an area where biofortification would have a key role to play. And in the case of iron, actually, there's a fair amount of consumption of branded wheat flour in rural areas of Eastern Uttar Pradesh, which presents an opportunity to cost-effectively reach them that way. And of course, it's really also important, highlights this thing of, hey, we need to do a little bit more to figure out where those 26% percentage of households are, what they look like, and trying to really target interventions to them. So what we did then is to, if you really want to focus on the role of biofortification, take that red area where households are not reporting access to any of these other sources and sort of blow it up and say, well, what are they consuming? Is their own consumption? And therein sort of becomes the key role for biofortification. And then, of course, you can do this, and we did that, look at wealth quintiles and look at female-headed households and try and really understand where the coverage gaps are. I'm kind of out of time, but I'm on the last slide. And this is really to summarize what our recommendation was, but it's really more about the tool itself, and the hope is that we can sort of collaborate with the folks who worked on BPI, FACT, and sort of come up with the practical and accessible tools which missions and programs can readily and easily use, because modeling sort of becomes a little bit of a black box. But overall, in terms of addressing micronutrient deficiency, I guess in the last session we said it depends a lot, but so context is key, and there is a role for different interventions for addressing the different populations generally. And there is a very clear sort of role for biofortification and iron and zinc, just looking across even Nigeria, which we did. And just one point I did want to make about this voluntary and mandatory standards, that when you have voluntary standards, and it becomes a little bit hard because a lot of the reach from fortification can come through oil and sugar. But if they're voluntary standards, then you kind of have to talk about oil and sugar being healthy, which becomes a little bit of a problem. So mandatory standards is much easier to talk about fortification. And further, then there is all this behavior change element that comes back in. So that's kind of important. And again, really sort of focusing on the role of expanding interventions that improve access to and use of micronutrient-rich foods. So thanks a lot.